my version of the Ignite talk. The current medical model for the last 100 years, as Bruce actually stole my talk, but I'll give it again. Over the last 100 years, the medical model has deconstructed the human and sort of into more manageable parts and situations. And they did a really good job. We've developed really strong medications, procedures, and intervention, and we've extended some life. But we're starting to experience some significant side effects of that process. Chronic diseases such as heart disease, diabetes, dementia still plague us, and common functions that we depend on, such as sleep and digestion and energy and sexual function, are increasingly dysfunctional among us. We're disengaged and disempowered from our own health. We're sick and tired of being sick and tired. And integrative medicine we're capable of a new medical model. We're capable of a medical model that promotes health, empowers individuals, and increases the quality of our life, not just solely the quantity of our life. So tonight I just want to briefly introduce integrative medicine, and specifically how we view the human, how we intervene, and then just kind of give you a little bit of where it's going. A little philosophy to guide us. So as Bruce mentioned, we're a process. We're not an object. We're very capable, resourceful beings. And this happens at conception, through development as an embryo, through the aging process. And this is happening on many levels, from the countless births and deaths of cells that happen on a moment-to-moment basis, to the unnoticed shedding of our skin that's occurring, to the overall evolution of man that's occurring on this large swath of time. We're a process, and we're all part of a continuum of life. We're each absolutely unique genetically and from our appearance, but we're all fundamentally human. We're overwhelmingly more similar, more alike than dissimilar or unique. And so, since we're this process, we're capable of intentionally influencing it. We truly train our beings. We express ourselves. This is literally happening in real time, all the time. We express ourselves genetically, biochemically, through neurotransmitters, through hormones, through our behaviors, through how we function. We are a process. This is a simple yet powerful concept. We are the co-creators of our lives. We're the co-creators of our health. Be mighty is my personal motto. When you view us as a process, then you can kind of begin to appreciate how we can start to assess ourselves, and we can look at it on many, many levels. So we now have personal genomics, so that we can see our personal genome. We can look at our microbiome and understand what our gut flora is, because we're actually not only are we a process, we're an actual ecosystem. And then you can kind of look at us as a total system. What is our fitness? What is our capability? We're mammals. We're meant to move. We're meant to perform. We're meant to act. We want to know how that happens on a big global level. We can also begin to identify these patterns that underlie some of the chronic common conditions that we all are struggling with as we age. And on a fluid level, there's congestion, inflammation, oxidation, and hormonal and metabolic dysfunction. And then we experience this as physical decline, pain, these problems with sleep and digestion and energy and sexual function, as well as disturbed psychological, emotional states. And so, if we view ourselves as a process, then we assess ourselves. We can then sort of start applying therapeutics in a different way, in a different model. So this will transform therapeutics from diseases and entities that we need to manage to sort of states of our being that we can engage and work in. therapeutic tools, therapies become more tools than crutches. They're enablers of health as opposed to regulators of disease. Lifestyle is the strongest medicine. Therapeutic tools are very powerful, but lifestyle is the strongest intervention. And the more proactive we can engage ourselves, the less invasive we have to be, the more subtle we can be with our therapeutics. And so the medical model starts to switch, and that we stop monitoring, measuring disease states, and we start monitoring and measuring health and fitness states of the human. So this is where we're going. So now we have this technological revolution in all of these products that are starting to kind of measure and interface. The health technology revolution is actually the mirror in which we're allowed that we're going to view ourselves. And we're going to view ourselves much more intimately with a million more data points, much more than going to see a physician and having a snapshot here and there. And so this is where medicine is headed. We are our own best health managers. Do not put your hands in the care of the best physician in the entire world. Put your care and your health in your own being. And so, in addition to all these individual medical devices and tools, now we're establishing these personalized health dashboards, like Jim mentioned, and we're able to kind of take all of these data devices and genetic measures and microbiome measures and fitness measures, and we're going to kind of bring it together and get what's truly called an integrative view so that we can interact and change. And so I wanted to just end in congratulating you guys for really having the foresight to put together a wonderful user interface and to be on the leading edge of this, because like the previous speaker said, this is, or Bruce said at the beginning, this is gigantic, and you guys are sitting here amongst the beginning of this gigantic movement. So congrats and enjoy.